I just want to walk you through this picture. It's actually two pictures of a plastinated heart that's been dissected. I want to walk you through this picture because this is kind of a weird dissection because it's been dissected through the left ventricle and left atrium. So again, left ventricle, left atrium, and you're looking into the right ventricle and the right atrium. These lines have been added to give you perspective, so each white line kind of represents where they follow on to that next picture. The important point of comparison here is that, and it's a weird comparison because it's going to be from right to left, but it's going to allow you to see the AV valve compared to the semilunar valve. So over here, we can see the right AV valve. You can see the way that the AV valve works. So it prevents backwards flow from that right ventricle back up into the right atrium. So you can see that there's a little bit of curvature of that valve downwards inferiorly into the right ventricle. You can also see chordae tendineae attached at that free edge of the valve and attached to papillary muscle. Whereas if we come over to the left ventricle and we exit into the aorta, we can see this small set of valves that make up the aortic semilunar valve, also sometimes called the aortic valve. Notice that in this case, when the ventricle contracts, it creates higher pressure than the aorta, and as blood flows out into the aorta, that valve will allow movement. When the pressure drops in the ventricle, those pouches will fill up with blood and close this valve off. Notice also that there's no chordae tendineae or papillary muscle. So again, here's that right atrium and right AV valve separating the atrium from the right ventricle. Over on the left side, here's that left ventricle. Here is the aorta, and then separating the two, you have the aortic semilunar valve.